Good evening, everybody, and welcome to Wellness Wednesday. I am Dr. Lauren Fisher, and I'm the host of Wellness Wednesday. I am here on behalf of the Wellness District of the Delray Business Association. And if you're not familiar with us here in the Alexandria area, the Wellness District is a pretty amazing group of health and wellness entrepreneurs. We have about 45 businesses, you name it, fitness, medical, holistic. And each week on my show, I get to interview one of these wonderful people and help you get acquainted with them and learn a little bit about a topic. So tonight, I'm really excited to have Dr. Lola Capps of Chrysalis Chiropractic. Welcome, Lola.
Hi, how's it going?
It's going great. Things are going well. You're my favorite guest so far.
I knew that was going to be the case for sure,
Yeah,
that I'd be your favorite guest. So,
of course.
but yeah,
So anyway, I got to just tell you a little bit about Lola. She's a staple in our community. I am very grateful to have her as a friend, but also, as she's a co-chair of the Wellness District. And she's one of the people that have been here, like the heart of growing the wellness, I guess, community here in Delray. You've been in the area since 2003. She plays a very active role. You may not know it, but she plays a big role in a lot of the events, helping to originate like Fit Crawl and the Wellness Festival, working really hard on our Wellness District Instagram. She likes to get everyone together. So, I say this because there are people that, just being a business owner on its own is impressive. Being a wellness professional on its own. But Lola is far more than that. So I am excited to have her here tonight to talk about chiropractic. And we've got some giveaways. And everybody likes some giveaways. So if we snap some, hello, Mary Wadlin. We've got some giveaways. Everybody could use a 45-minute massage. We've got that. We've also got a t-shirt and a rest and relaxation package. So we love to do trivia. So we're going to have a few trivia questions throughout the show. So stand by. And when if you think you know the answer, put it in the chat box and we will let you know. All right. So also, hello, Michelle. And if anyone else is watching, say hello. We like to know who's there. We encourage participation while we are going to chat. This is always much better when questions come from the people and we're helping, advance your knowledge too. All right, Lola, or talk to Lola. Tell us a little bit about your practice, please.
All right. Well, definitely thank you so much for having me on tonight. Super excited. I am Dr. Lola Capps. I am owner, along with my husband, of Chrysalis Chiropractic. We have been open in the Delray neighborhood since 2003. And our office is a practice that we do chiropractic, but then we also have massage, we do nutrition. We're all about, whole body, full body wellness. We want to make sure that people aren't just coming in, and I know our topic tonight is going to be more of pain, but people come into us for so much more than that. And we love that we're here in the community. We love that we're able to, participate in all the stuff that always is going on in Delray. It's like we're always full of events. So yeah.
Yeah, I think it's important to highlight all of your services because I know that you take a really holistic approach to people's wellness. And while often, and never going to get into pain, is that's why a lot of people come to you and come to chiropractic, at least in my experience, that's how I did. I throughout my back and someone's like, you should try chiropractic, So, but I know you're going to in a little bit talk to us about all the other things that you could do to tune into your health. But if you had to explain to people, because there are still a good amount of people that don't understand or don't know about chiropractic, and I think honestly it scares them a little bit. So can you tell us a little bit about like what chiropractic care is?
So it is funny to me that we have been in practice since 2003 and that there are still people that come into our office that have never been to a chiropractor, that have never been adjusted before. And these aren't people who are, in their early 20s and that they wouldn't have been able to experience it. We have people that are well into their 40s, 60s that come in, and this is like their very first time getting adjusted. It is also very interesting that people, when they do come in, you're right. They absolutely come into our office because of a pain. Something's bothering them. And more often than not, it's somebody saying that, well, I've tried everything else and you're my last resort. And I'm coming in to see you because I've tried all the other stuff. And, and that's when it's really great to be able to get them one feeling better, but then kind of getting them to where that they're seeing that there's so many other benefits. One of the biggest things that I think, like, someone will come in because they hurt their back, right? And as we start going through and we do an exam with them, we notice that other things are really tight. Maybe that their hips are not moving very well, or as we get into the neck area, that their neck, they can only, they turn it maybe this far, and they don't realize that they're turning it much less than the other way. So
Mhm.
it's really interesting as we go through it, and then we start working on stuff and they're like, oh my gosh, I didn't even know that that was a problem. So then from there, the other thing that we really notice a lot of is that people will oftentimes say, well, the thing I came in for, that's a little bit better, but I really noticed that for the past 2 nights I've slept amazing. They're
Mm.
like, I'm less stressed. I'm able to sit in my chair longer. Things like that, which really, that's what I love, is that people start to then see that it's more than just that pain that they're having, that they need to kind of get rid of that pain, that it kind of gives them back a little bit of their life, honestly. So,
Mm. Yeah, so that's interesting. So people will come out and seek you out for localized pain, but as they're getting treatment, they're realizing other things. They're benefiting in other ways. So you mentioned that sleep is one way from just general like chiropractic care, because we talk about people
mhm.
coming in from being in pain, but if they just want to come in for health, like what are the big things that you say chiropractic care or adjustments would help with, or how could people benefit?
So I have to preface this by saying that chiropractic never treats anything. We never treat a disease or an illness. It's always that we are making sure that the spine, the bones in your back, that they are moving the way that they're supposed to be moving. Every single vertebral bone that's in your back, every single joint in the neck, in the thoracics, and the low back, every single one of those is a joint, and every single one of them should have movement. So it's not like I don't know if I could do this on here, but it's not like your elbow, right? Like that's like big movement. Every single one of those joints in your back, it's like a little bit of tiny movement. So that's what, when we go through and we do our exam, we're looking to see, from side to side, is it moving the same way? Is it tighter on one side than the other? Can you bend the same on both sides, right? So when we're doing that, yes, we're moving those bones, but we're also affecting the nervous system. We're affecting the spinal cord. And so we're really making sure that the connection between your brain and the rest of your body, whether it's your organs or it's your muscles, your feet, your legs, like whatever that it is, that that connection is going from point A to wherever point B is, and that it's getting there the right way. So that I want to preface that in saying so with things that we see that people will tell us, definitely the sleep is one, allergies is another one,
Mhm.
anxiety, gosh, earaches. We see a lot of children, and we'll adjust them and it'll help with their earaches. We also know, with adjusting babies, we also have where, babies that aren't nursing very well, they're not going to the bathroom, that kind of stuff. So it's a lot more than just feeling that, making sure that that back pain is better.
Yeah. I don't know if I ever told you this. My mother used to work for chiropractors, all while I
No.
was growing up. Yeah, and I had really bad allergies as a kid, and terrible headaches. And I went, and that solved it until I moved into DC. And I just learned today about the cherry blossoms and how they're the reasons why people are having severe allergies. But anyway, that's a tangent,
Oh, that's
right? So.
interesting. It is funny of that when people do move here from other places, which we're such a transient area, it's not uncommon, for
Mhm.
new patients to be like, oh, I just got here. And so many people are like, I've never had allergies. Why do I have allergies? Like, this is crazy. So,
Well, apparently this is a random fact. The cherry blossom trees are male trees, so they tend to pollinate more. So that's why
oh,
allergists are in
so
business with them. Mhm.
So last month at there was some day we had like a really windy day, and I was reading that about like the pine trees and like the oak trees, and they were talking about how like the male trees, and so that they can get it all out, and it's like the wind is there, and it's like the perfect scenario for pollinating everything. And I was like, oh, no wonder. I was like, because I was just constantly like sneeze, sneeze, sneeze. I was like,
Yeah.
what is happening?
But more or less, like chiropractic could, help alleviate some of those symptoms or regulate your response to the things you're
And it's
experiencing.
exactly it. It is
Mhm.
helping to regulate the response that your body is going to have. And I'm
Yeah.
not saying that it's like, that yes, everybody come see me now because the cherry blossoms, the males are like making everybody sneeze. That's not what I'm saying. But
Mhm.
for
Big
somebody
leap.
that doesn't want to rely solely on taking, different medications and stuff, they
Right.
find that chiropractic can be a nice addition into what they're already doing to help with it. So, which is awesome.
Yeah. Okay, great. So, hello, Bridget Brown, too. I just want to say hi to her. She's one of our top fans. So we're gonna go into a little
Hi,
video,
Bridget.
taking a look at. We're gonna play this video in a second to look at some of the procedures that you do in assessment, and then right after that, we're gonna have our first trivia question. So stand
Okay,
by.
so can I set up the video? This would be someone. This person has already been to our office. Well, actually, it's our front desk person. So she's been adjusted many times. So she did the video for us just to kind of give an idea of what an adjustment looks like on average. So everybody's adjustment is always very unique to them and what they have going on. But this is kind of an average of kind of what to expect. So
That's great.
the other thing that I want to point out, and I don't know if you've ever watched any of the chiropractic videos where people are getting cracked left and right and there are all kinds of noise and stuff, is that you could see with this, like it's very specific, it's very precise movements. It's not like these big, huge movements where you're jumping on somebody's back or twisting up their
Mhm.
body to try to get things to move. Like even the one where she's laying on her back and she's getting her neck adjusted, you can see her neck moves very little, but it's just a
Yeah.
very quick adjustment. It's coming from the hand and it's a very quick movement that allows for the bones to move into place. So, um,
Yeah, I mean, people always like, I hear about your neck cracking, but like it actually feels really great. Like every time you
yeah.
get adjusted and moved around. And I was particularly impressed. Your husband was able to help me out. I've had recurrent back injuries over time, and I'd say when I went to him was the fastest anyone's ever helped me. And maybe he's awesome, but I think he did things that were different. And it was like he zeroed in right in and like was doing, is it the pressure release? I'm forgetting the actual like term, but it
So,
looked
in
like it was
addition to
happening.
doing the chiropractic adjustments, he does active release technique, which works specifically with muscles, tendons, ligaments, and nerves. So, doing that along with doing the adjustments can help to give it so that the adjustment lasts longer. So, you don't have
Yeah.
that after you have the adjustment where the muscle hasn't been worked on at all and it's pulling
Mhm.
it back into the place that you don't want it to be. So,
Yeah.
yeah.
Well, I was
And
like,
someone asked a question. I think it says
yeah.
Michelle. wanted to know, can a pinched nerve benefit from chiropractic care? And my general answer to that would be sure, but there's also lots of variance within that. There could be where it's a nerve that is pinched in the sense that it has pressure being put on it, and it's kind of like something that's being irritated. And so, yes, that could actually benefit from it. Then there's other cases where it's really cutting off, like it's really, really compressed and it's putting more pressure. And I would say that for that, you can still have some sort of benefit, but typically we're not working in that. We're working at things above and below it. So we can keep those moving so those things don't start to compensate and make more of those like pinched nerves, if you will.
Great. All right, awesome. Let's move on to our first trivia question for those of you who are paying attention. Okay, Lola, this is for your t-shirt, which is very comfortable and a great workout or lounge shirt, by the way.
And it's super cute.
Okay. All right, go ahead with the question.
Are you going to put it up? Because I don't remember what we said the first question was. Okay. In 1895, the first chiropractic adjustment was done on a man named Harvey Lillard by D.D. Palmer in Davenport, Iowa. What changed for Harvey? Is it A, his hearing was restored, B, his headache went away, or C, his back pain stopped hurting?
Okay, put your answer in the chat box and we'll see who gets the answer right. So chiropractic has been around for quite a long time.
Mm-hmm. It has been. If I could do some math. So 1995 was 100 years.
Yeah,
so,
I think that is.
So I think actually 2020, I think, was our 125th year anniversary, because I believe that we were supposed to have a big, huge celebration last September, but because of COVID, we did not have that. So it was supposed to have been a pretty big deal.
Well, happy anniversary to you and your people in the field. Okay. So Bridget Brown has answered C. Oh,
there's a new person.
Yeah. Okay, who's the winner, Lola?
I can't. Is it Cassia? Cassia? It's that person that said A.
We hope we're not butchering your name.
Sorry if I completely butchered your name. I also don't have my glasses on too, so I'm like trying to I thought it was a Kadia, and it's not. So yes, his hearing was restored, and the story is that Harvey Lillard had been not able to hear out of his ear, as opposed to someplace else you'd be hearing, but he wasn't able to hear for like 17 years. And D.D. Palmer, who is the founder of chiropractic, started to ask him some questions about it and had said that, well, I think that it could be due to an injury in your spine. And he laid him down and he gave him an adjustment and his hearing came back. So that is the answer. It's a pretty cool story.
Awesome. Oh yeah.
And this is a testimonial thing that is that's out there.
Cool. Great. Well, we will get your information in the comments, but stand by. You could be winning two more things. All right. So let's move on to a little bit. You talked about people reach out to you for pain. Why? What are you making about all these people with back pain? Why do people have so much back pain?
Well, I mean, there's lots of reasons of why, people have back pain. In the chiropractic sense, we like to look at it that there's three things that can cause problems with people, and that can cause them to have a misalignment of their spine or a subluxation. And those things could be something physical that happens. It could be something emotional that happens, or it could be something chemical. So physical is super easy to get what that is. You hurt yourself, you fall, you do something like you're in a car accident or whatever. So that's pretty easy to see that you would have something that's bothering you. Then there's also the emotional component of it, which is, I would more so like to say stress. Stress, everybody says all the time, oh, I carry my stress in my shoulders, or I carry it in my neck. And it's true. It's, people do that. And, whether it's because you're so stressed that you're physically sitting there and you're just about something, or just overall that your muscles, cells and everything in your body that just everything is carrying all of this like burden and this like problem. Then from there you have other things that happen hormonally, like cortisol releases and stuff like that. Then the last one is chemical stuff, so the things that you're putting into your body, whether it's things that you're doing like poor food choices or things that you're missing from your diet, like the proper vitamins and minerals and stuff like that, that could also be causing some problems as well and creating some pain issues. So
Mm.
and then for right now, like I would say, like if I had to sum it up, like really for the majority of people, like honestly, like I would say that one of the biggest things that you honestly see is people and their lack of movement. That is the problem. So much of that people just sit, they're sitting and they're doing computer stuff, and it's just, this repetitive, hand stuff that they're doing. They're not moving their lower body enough. They're not like getting out and and it doesn't even have to be exercise that I'm saying that they're not doing, but just general,
Yeah.
just overall movement.
Hmm.
And that, it's just that's not what we're meant to do. So, you think if you've been sitting down for 8 hours and then you go to stand up and your back hurts, well, you've had it in one position that it's not meant to be, where it's sitting like this, and then you go to make it straight and it's kind of like, I don't want to do that. What am I going to do that for?
Sure.
So it sends you a signal that's like, hey, I don't want to do that, that hurts. And
Yeah.
and then from there people either don't do anything, they don't get extra movement, they don't go and walk or try to stretch or do anything, they don't do chiropractic care to get the joints moving. They don't do massage to get the muscles, loose and stuff like that. And then the problem just sits there and it's exacerbated over time. And so then it ends up to be a bigger issue later.
Yeah. Yeah. Yeah, I wasn't planning on asking you this question, but and now that we talk about it, just because so many people are working from home and they have less movement than they normally would with commutes and things. And I know
Mhm.
people probably hear they need to move, but for those who are sitting and sedentary for most of their day, like, is there anything you're recommending, even in their chair, the type of chair they're, or how can they get moving their body, or how often should they be
So
moving? So,
I would say the better thing to do is to be standing, and that's
mm,
actually become more and more popular. It's I can remember years ago, people were it was first coming out, and people were like, I can't stand all day, like that would be ridiculous. And then you start having people doing it, and they're like, oh my gosh, I can't imagine sitting all day now after doing a standing desk. So that would be my first thing that I would tell people to do. The next thing I would say is if you are sitting, is to get yourself up and take, walk to the bathroom, walk and get yourself some water, go walk outside and walk down the block and like come back, that kind of stuff that, even people who went from being in an office before to now being at home, they have found that they're moving so much less. Like, right, like they're not taking the walk to get to their car to then drive and then walk to the office. They're not like going down the hall to talk to their buddy in like the other room or whatever. They're not going and walking to a meeting. Like literally people are sitting and staying on
mm.
Zoom after Zoom after Zoom after Zoom. So that would
Well,
be
with that
that'd be the
said,
easiest.
yeah, that's great advice. And with that said, hey, Steve, just in time for our next giveaway. Because with everyone sitting and your pain and like body being stiff, what'd be really nice is a 45-minute massage at Chrysalis
That would
Chiropractic.
be. Hmm.
So let's go ahead with
Heather
our
is our
next
massage
trivia.
therapist.
Yeah.
Sorry.
All right. Let's go ahead with our next trivia question. And for those of you who would like a massage, go ahead and put the answer in the chat box. Okay. Take it away.
All right, so the human spine has 7 cervical vertebrae. Those are the ones in your neck, 12 thoracic, that's the mid back, and then 5 lumbar, which is your low back area. The human neck, on average, is about 5 inches long. A giraffe has a neck about 6 feet long. How many vertebral bones are there in a giraffe's neck? Who knows the answer? Guess a number.
Such a random question. I love giraffes.
They have like crazy, really like long tongues too. Like I think
Mm.
their tongues are like 2 feet long or something like that.
I was going to go off on a tangent, but I was like, I wonder, are
Have
there
you ever
like,
have you ever fed a giraffe like a carrot or
no, I
something?
haven't fed a
You've
giraffe.
never
Who's
done
fed a
that?
giraffe?
So
That's so random.
I've fed a giraffe. Their tongue curls around the carrot.
Oh, wow. Well, that's a fun fact. We're just throwing out odd facts. Looks like we might have a winner here.
Yes, Michelle, you are correct.
Woohoo!
It is
Yes,
7.
massage. And Heather's awesome. Yeah,
Yes,
I
Heather
know,
is our
Mary.
massage therapist, and we will reach out to you and help you to, get it all set up and stuff. So you'll love Heather.
I mean, quite honestly, if there's anybody else listening that's fed a giraffe, we're just going to give you the last giveaway right now and be honest. Because, Lola, I don't think you understand that that's pretty unique.
Mary was going to say that there are 42.
That's what I would have said, right? Congratulations, Michelle. Okay, stand by. So we're just gonna a little bit more. Okay, so I believe my father is watching this, and he would say, and he knows this, that he's very good at like ignoring pains, like, and some of it's generational. Hey, work through it, ignore it, right? And we give him a lot of grief for it. So, but I know I tend to do that. I think other people do that. We're busy. We don't have time to tend to things. So, how do you know the difference about like sometimes we have transient pains, right? If we worked out or twinged something, like when should we be seeking out chiropractic care?
So, first off, I would say that everybody needs to have chiropractic care because everyone has a spine. So, it just doesn't make sense to me. Everybody has teeth. You go to the dentist, you wouldn't skip that. So, kind of goes the same with me and my thinking. But if for your question of that, sometimes there's just transient pains. And yes, sometimes there's a pain that comes and it goes. Sometimes you get a little neck thing or whatever that comes and goes. But I can tell you that every single time that you have that little pain, if it's gone deep enough into like the muscle and the muscle's pulling on, then like on the vertebrae, then it's going to create kind of like a little, almost like a little bit of a memory there, or like a little bit of a scar. And it's not a true scar like if you cut yourself, but there's going to be some stuff that happens there. There's going to be an inflammation response. It's going to get hot. There's going to be extra fluid put to the area. And so if you have enough of those, you then are going to end up where eventually at some point you end up having a chronic problem or a problem that's just much bigger. And people generally just tend to wait until the problem is much bigger before they actually address it. So I would say, I would say that you should wait I mean, not wait, I'm sorry. I would say that you should get adjusted or have your spine checked out before that happens so that you don't end up where you're like, oh my gosh, like I can't move my neck. I mean, because we literally have had where people walk into the office, or actually, I shouldn't even say walk, have crawled into the office.
Yeah.
Where they have, been taken out of the car and just got down on all fours and come into the office. And that's not the first time that they got hurt, right? Like they didn't just like wake up and all of a sudden couldn't move. That's
Yeah.
like pretty much nobody does that happen to. Do you know what I mean? Like there's going to be little things that happen over the way. Even the person who, wakes up and they are like, oh, like I can't move my neck. Generally, when you start going back and you do the history with them, they'll, talk about like something that happened even when they were a kid. They're like, oh, I fell off of a horse and, my neck was all like whatever for like however long, or even like maybe they didn't even do something to their neck, but it was their shoulder and they're like, oh yeah, I wore like this like crazy shoulder brace because I couldn't really move my arm very well. It wasn't working, but it wasn't broken, but it wasn't like really moving the right way. I
Mm.
can say, for example, for myself, that I know that when I was a kid, I fell on my wrist. And I, lived with my grandparents and they were like, you're fine. It's not broken. There's no blood. Wrap it up into something. And so literally they wrapped something around it and then put me in a sling. And I was like that, I don't know, probably a week or whatever, just kind of walking around.
Yeah.
And then as I got older, I can remember playing games where you have to like do things where you're hitting a ball or like a volleyball, and it would always hurt so bad. Like I couldn't do it. And I was like,
Mhm.
I can't do it. I have bad wrist. Well, fast forward to chiropractic school, and there's adjustments that you can actually do on your wrist because it's a joint. And so, as for chiropractors, we can move any joint. And I started getting it adjusted, and lo and behold, look, like they move, they don't have pain, and it doesn't
Yeah.
bother me anymore. So yeah.
Yeah, I mean, I love the parallel. You and I always talk about like physical like wounds and emotional wounds, right? You ignore
Mhm.
them, they are going to manifest in some way. But like there's just I think so much even with that, like you're talking about just the ways we don't even know how to tune into our body, that like, you know, that there are, there are ways to manipulate or fix or help that body like
Yeah.
realign so it's healthy and doesn't keep repeating patterns.
Well,
So that's,
exactly. Yeah. And
miracle
the other
working.
thing too is to always remember that so often people, are so frustrated that they're in pain. And I get it because pain hurts, but it's always a good thing to remind yourself that, yay, I feel pain, because pain means you're like alive and you're actually feeling something. And it's a
Yeah.
message to your body telling you to go and do something about it.
Yeah.
It's not
Yeah.
like, it's not just happening for like, you know, s and
Right.
giggles. It's just kind of like, go
Yeah.
do something.
Yeah, so instead of being, like, annoyed at the limitation, be like, "Well, thank you, body, for, like, giving me a signal that there's something I need to attend to." What a
Yeah,
beautiful
absolutely.
reframe. Uh, okay, I can't believe it. Maybe I'm the only one that hasn't fed a giraffe, but Cassie has fed a giraffe, so she has just won the second
Yeah.
or third giveaway. Tell the
Oh,
giraffe
I
goodbye.
fed
I
one
mean,
in
this
San
has
Diego.
free my mind. Okay,
Again, I don't have
yeah,
my glasses
right.
on, and I'm like, "She needs one in San Diego? She's in San
Yeah.
Diego and she's not here."
Nope. So congratulations, you secured that on that trivia giveaway. Yeah, Mary, me neither. We need to figure out if we can do this at the National Zoo. Take a little trip. All right, we have a few minutes left here before we wrap up. Please, we encourage if there's any. Oh, someone did ask a question. Okay, Mary said she never thought about adjustments for other joints. What about arthritis?
Actually, that's a great question. So arthritis actually happens when joints are not moving well. That's why you get arthritis. So it doesn't necessarily mean it's just because you're getting older that you have to get arthritis. Arthritis is setting in because the bones in that area, the joint, is not moving. The fluid is not getting there. And so what happens is that it starts to put down extra bone, giving you arthritis, and then you have decreased movement because there's less room in there. So if you were to look at a X-ray of a spine, it would show that instead of being, oh, that would have been an excellent picture to have, but instead of showing where
Yes.
the bone is nice and even all the way around, it shows where it's kind of got extra bone, or like almost like a little like chip on it, of where there's like an extra little growth that's there because that joint's not moving well. And so the bone says, oh, we're not doing what we're supposed to be doing. Put down some extra like bone there so that we don't like get loosey goosey and like do something that we're not supposed to. So it kind of fills that space up a little bit. Now that's also different because I'm assuming that you're asking about that kind of arthritis and not like rheumatoid arthritis, which is on a whole different level. So we're not talking about that kind. We're just talking about your regular when somebody says, "Oh, I'm old and I have arthritis." So yeah.
Yeah, and I know you and I are really big on like positive aging and not
Mm-hmm.
falling into these beliefs that like our body's breaking down and that we have like choices and control. And my last question was going to be about how chiropractic care like assists with healthy aging. And I think you just highlighted one way, right? If we're moving right, that might like decrease the amount of pain or arthritis, but also just
Yeah.
elaborate on
Well,
that. How does it help?
yes, it helps with that. It also, if you have that, so if you have an older person, what are the things that are problematic for them is typically that falls, right? Falls are something that's going to like make them get injured, and that because they're older and they have less bone mass, they're going to have more problems with it, right? Well,
Mhm.
you also then think about that they have a problem when they go from sitting to like standing. So if you are getting adjusted as an older person, you're going to be keeping those joints moving well, so your hips are going to be moving better. And so when you go from that sitting to that standing position, you're going to have more confidence. You're going to be able to like it's going to feel good. You're not going to be like, "Oh, it hurts," and kind of catch yourself, or like end up falling because you have that pain. So I would say that there's that part of it, and then just that general. I think that like that confidence, I think, is just a good word for as you get older. People just have in their mind that, oh, I can't do something because it hurts or it doesn't feel good or I'm not supposed to be. But if they're actively taking care of themselves, then they can do it. And so then they're more likely to be like, oh yeah, I can go, and do that. I could say that the oldest person that we ever had come into our office, he was 99 years old, and he came in for a chiropractic adjustment. It was not his first adjustment. And he was so cute because I can't remember exactly what his complaint was, but he had something in his back area. And he's like, well, he's like, I used to be able to like bend over. And so he bends over a little bit and he's like, but yeah, I could still do this. And he starts lifting his legs up, like almost doing this dance. And I was like, you are the most active 99-year-old man like ever. But he was like, he knew that
Yeah.
he was like, if I let one little thing go, that could then
Mhm.
cascade into the other things, which I was like, I love that. I love that he knew that he needed to take
Yeah.
care of everything and not just let it like kind of go. So
And
yeah,
he might be
it was
still
pretty
ticking
cool.
away. Yeah. Keep moving, keep living,
Uh,
right?
I would like
Okay.
to say so, but I'm sure because that was like probably in 2010, 2012.
Yeah.
So, but yeah,
Yeah. Okay. The takeaway that people should go to a chiropractor like they do a dentist to stay healthier and get adjusted. Yeah. So, and that's a great point. Like, and let's wrap up
I
with
agree
that
with that.
about like, yeah, what does routine care look like? So you do think it should be part of a routine healthcare
I
regimen
do.
and awesome.
Yes. And I will have, some people that, that move to the area and they're like, yeah, they're like, I get, regular adjustments, and their regular adjustment was last year. I would say that that's not very regular. I would say that what I see that does the best, and this is going on from my chiropractic standpoint of when I'm palpating the spine and feeling the range of motion and knowing how it feels to me, that it's ideal would be every couple of weeks. And then from there, I would say like maybe every 3 weeks to every 4 to 5 weeks. Something like that would be something that I think is reasonable to say that somebody's getting regular care and that they're taking care of themselves and their joints to keep them moving well. Now, within that, if somebody is, doing that and then they have something that happens, like let's say that they're working out and they're doing deadlifts or something, then and they end up hurting themselves, they pick up the weight wrong, or they pick it up and it's too heavy, whatever it is, then they need to come in extra. They shouldn't wait until that point. So they should try to get in and get an extra adjustment in between there. So mhm.
And one last question from
Yes,
Kat. Yeah. Okay.
absolutely,
Okay. Lola can
100%.
see now. Lola can see. Great.
Well, I saw pregnancy, so I just I could see. I saw pregnancy, so I knew what she was asking. But yes, pregnancy and chiropractic are like peas in a pod. It is awesome to get adjusted while you're pregnant. There's so much change that goes on within the women's pelvis that making sure that things are in good alignment helps for better positioning for the baby. It can also help to make sure that delivery and labor, or I should say labor and delivery, that goes smoother. So yes,
Mhm.
absolutely. And even in that short video, I'm not sure if you were on when it came on, but that one table that went from the standing to the laying down position, that is a table that actually has a piece in the middle that goes down so that someone who's pregnant can lay there very comfortably. And I can tell you, 9 months pregnant, when I was having my pregnancy, that it was so nice because you can't lay on your stomach any other time, and to lay on that table was amazing. So yeah.
Yeah. And that's really cool to hear because we had Sarah from Mind the Mat last week talking all
Hmm.
about how her Pilates and like the different ways to support you through the pregnancy. And I think we're just all better when we're proactive about our health and putting in these like
Absolutely.
different, and that's what's cool about the district too. There's just so many like integration of different doctors and wellness professionals that
Yeah.
can really work together to really get you know, make sure that baby comes out okay. No, a
Yeah.
healthy pregnancy.
See, and actually, it's kind of cool too because the other time that I would say that it's really that the women that stay getting adjusted during pregnancy is that they really notice that after they have their baby, that where they need to get adjusted shifts, because typically what most people spend all their time doing is looking down at their beautiful little newborn, and then they're like, "Oh my gosh, my neck, it's bothering me." They
Mm,
don't want to put their baby down, so they're like, "Oh my goodness, my wrists, my arms, like I can't move them. It's so uncomfortable." So yeah, so even after pregnancy, it's great as they're going into that next stage. And that next stage has a name, I can't think of it, but it's like you're still kind of, what is it, like the 10th month of pregnancy or something like that, the next 10 to 12 months of pregnancy or whatever. So, yeah.
probably. Alrighty. Well, Lola, do you just want to say for people, I want you to tell your website and where they can find you, but also that you do accept insurance, right? And insurance does cover some chiropractic, which is good to know because I know. for some people.
Yes.
It's really important.
So we do take insurance. We do bill out to most insurances. Well, actually, we'll bill out to any insurance, whether or not they're going to pay or do anything. That's up to them. The biggest thing is that I would say that most PPO plans do have some sort of chiropractic coverage. It depends on from there of like, what they decide is the number that they give or the dollar amount or whatever. But I find that even people that don't have coverage or that have really large deductibles still choose to like pay out of pocket and come in because they're like, this is so much more of a benefit than me waiting on some other things or whatever to
Right.
do. Mm-hmm.
Okay. So, and you have an active Instagram, Facebook, and is it, what's your website? Oh, it's right there. Chrysalis Chiropractic, right under your name. Who needs a
Yep,
vacation?
chrysalischiropractic.com. And then our Facebook and Instagram is basically, it's the same thing. So,
Yeah, and if you don't follow us, also find us on Wellness District. We've got Facebook and Instagram. And that's where we're updating all the cool happenings in our wellness with the wellness businesses, and Lola does a great job there with that. So, thank you so much for sharing your knowledge and your expertise and your warm, kind, loving soul with all of us tonight, Lola.
thank you for having me. It was lots of fun. Hope I answered everybody's questions too.
Yeah, and if not, I'm sure they
So,
can
yeah,
find you.
they can find
Yeah.
me.
Okay, great. So thank you. And then just to wrap up, everybody, I want to remind you that we've got some other amazing ZTV live shows. Tune in tomorrow night at 7 p.m. We have Alyssa Kovich with Alexandria Makers Market. And on Monday, we have Steve Hauks living with music or on music. And he always has great guests. So tune in there. Also, one other thing to just keep in mind, Zebra and ZTV, or Zebra's going to do some Zebra Lives for the next few Wednesdays at 5 p.m. to talk about Spring to Action. If you're not familiar with Spring to Action, that is a huge fundraising day and campaign that happens here by ACT on April 28th, in which everyone raises tons of money for nonprofits. But this year, the Delray Business Association is challenging the Old Town Business Association to see who could raise the most amount of money. So if you're going to give your money, consider giving through the Delray Business Association because we are just way cooler. So I would encourage you to do that. You can still give to whatever nonprofit that you would like to give. And it's a win-win for everybody. So we hope to see you. We'll have that information, but Zebra will have featuring different nonprofits and other businesses that are promoting for the day every Wednesday. Okay. All right, everyone, have a great night. And remember, be the good news in someone's life.